insurance company. The health is delivered by hospitals and the health facilities. And RUFA is one of our biggest stakeholders. We have government hospitals, we have other private hospitals, but this is an organization that has organized themselves for rural hospitals. So they are having their convention, and we are here so that we can respond to any issues that they have, tell them also what we are doing at NHIF. And we've already had an engagement with them, and as I said, they are a very organized group. I was very pleased to hear and to know that they have, when they came to see me, that they have an anti-fraud policy, which I have told them they should cascade, should be cascaded to other hospitals, such that when they onboard their facilities, then we know that they have a charter of what is expected of them. On the issue of rebranding, you know, NHIF was National Hospital Insurance Fund until last year. And then we became National Health Insurance Fund. There has been no transition. I think there have been very many issues. So now we are in a situation where the whole government is really looking at NHIF in terms of how it can deliver the UHC. And therefore we are waiting for the outcome to see the best method of delivering UHC. And the discussion about rebranding of NHIF will come after that discussion is over within government. Basically, we appreciate RUFA as one of our health providers. The benefit is that, as you had the discussion going on, is that there is need also to educate RUFA because they interact with our patients. The more informed RUFA is, and you had like the issue of capitation, or the reduction from 100 bob to 83 bob, and the explanation that was given. Anybody who has information has power. So they would be able to be also ambassadors for NHIF because they are the link between us and the patients. So the more knowledgeable RUFA is, the better for all of us.
RUFA has been a formidable partner for us in delivering of our promise to our members, and also were the first ones to actually accept our contracts of comprehensive contracts, meaning that for our members who go to their facilities will actually walk in and walk out without paying a single shilling. And because the spirit of universal health coverage is to leave no one behind, they are indeed a partner that we are working with. And in this conference today, looking at digitization, is that if we're going to be able to impact everyone to the last corner of the country, then using digital platforms will be key. So this will ensure that our members have quicker access, more efficiently, and also that the RUFA members get reimbursed for the services that they render in good time.
Thank you very much. We also have an
an association of 323 private hospitals in Kenya. We are operating in rural areas. In Kenya, we are present in 43 of the 47 counties. So there are just about 4 counties where we are still working on membership. We are almost everywhere in Kenya. Today, we have a meeting here, which is our annual convention here in Westlands, Nairobi, where we are meeting stakeholders from government, from the industry, stakeholders such as the Ministry of Health, the NHIF, stakeholders such as Amazon Web Service, and equipment and medical pharmaceutical providers here in Nairobi to discuss how to improve access for Kenyans living in rural health, rural areas. So we have had a very good meeting. The morning session, We had NHIF chairman, we had the CEO of NHIF, and we have made a joint commitment between RUFA, which is our organization, and NHIF for 3 things. Number one, together with NHIF, rural private hospitals are going to ensure that universal health coverage becomes a reality, just the way the government has committed that they are going to make sure healthcare is available for all Kenyans. We as rural private hospitals, which are serving about 42% of Kenyans, we have committed to support NHIF in that endeavor. We know that there have been complaints about the amount of money being paid to hospitals being reduced, but today we heard very clearly from NHIF that once UHC comes on board, even this number of patients who will be able to access hospitals will be more. Therefore, even though the amount of reimbursement may be on the lower side, the number of patients increasing will make sure that the hospitals can break even. So that is number one. Number two, we have agreed with the NHIF and the Ministry of Health that a proper policy for digital transformation of health needs to happen. So we are talking about the use of telemedicine, remote medicine, to help members of the public access healthcare. We don't have enough specialists in Kenya, especially in the rural areas. But we want to see how technology can be used. For example, if you have a specialist only in Nairobi, can we connect that specialist via an internet link through, our mobile providers? Can we connect them to a rural area in Embu so that a patient who needs to have a cardiac consultation for a heart problem can be treated without the specialist having to travel from Nairobi? And we were discussing that together with the Ministry of Health and the NHIF, and we have agreed that once the policy is in place, NHIF will start paying for things like telemedicine so that all Kenyans can access healthcare easily. The third thing that we have agreed today here in this convention is the issue of portability of patient information. One of the challenges patients are facing in Kenya is today, if you are sick in Naivasha and you travel to Mombasa, the doctor in Mombasa does not have your medical records. Today, together with our partners here like Amazon Web Service, we've discussed a framework where in the near future it will be possible for you to get care in Nyandarua, and when you travel to Nyeri, the doctor there in Nyeri can access your medical records and they will be able to offer you care. So that if you have a drug allergy, for example, you don't get misdiagnosed because you traveled from where you stay.